Hey, what's up, guys? It's Pat, and today I want to tell you about my nursing experience. This seemed to make a lot of sense after last video on my nursing school experience. And I'm telling you this with the same goal as the last video, and that's to give you some insight into my journey and so that you can see if you have any similarities or parallels to where you're at right now. And hopefully this will help you move forward and work towards your goals. So when I was in undergrad, I didn't really know what type of unit I wanted to work on, but I had an advisor and he really pushed me to do my senior practicum in a CVICU. And this was one of those things that at the time, I didn't really appreciate what he was doing for me. But looking back, it's clear that this was a moment where somebody in my life knew what I needed a lot better than I knew what I needed. And I'm really grateful and appreciative that he pushed me down the path that he did. So I loved my senior practicum. I loved being in the CVICU. I knew it would be a place where I'd be challenged every single day. I loved all of the new groundbreaking, cutting edge technologies that we're using. I thought it was just so fascinating. And I also loved the heart really more than any other thing that I've learned about so far. So it seemed like a perfect fit for me. So I eventually applied and I secured a job to work there as a nurse once I graduated. And around 4 years ago to the day, give or take, I started working as a nurse in a CVICU in a quite large, well-known cardiac surgery unit. So to start as a new grad critical care nurse, we had this nurse residency, and there was a critical care class, and we had some fantastic nurse educators. And this was the first time I feel that I actually dove deeply into the human body in a system by system way. And in my last video, I sort of told you guys that when I was in nursing school and clinicals and I saw the role of the physician, I knew myself well enough to know that if in fact I did love medicine, that I would want and I would really need to be a physician one day. And here I was about 3 weeks into working as a nurse and in my critical care class and being on the unit a little bit, it was so clear to me that I loved it so much. I thought it felt so intuitive to me. It really made sense. I loved learning more, but I also loved having my mind and my eyes opened to how much more there was to learn. And I wanted that knowledge so bad. And I wanted to one day be able to use that knowledge at its highest level. And pretty much a month into being a nurse, I bought MCAT books. Now, I didn't take the MCAT right away, as you know from my previous videos, but it was really a commitment to myself. Now that I understood where I genuinely felt my passion was in this life, that I would accomplish it and I would get there one day, no matter how challenging, no matter how difficult, no matter what obstacles stood in my way, I would accomplish it. So being a new grad nurse in any unit is challenging. And man, I definitely struggled. I struggled really so much. When I was in orientation, whenever I would go and get an assessment done by my managers, it was always, Pat understands what's going on pretty well, but I always struggled getting my stuff done. I struggled with my time management, with my organization. I struggled with accomplishing tasks and getting some of my nursing skills done efficiently. And I really had to hunker down. And I realized that I had to improve, I had to get better. And there wasn't really time for me to work towards getting to medical school. I had to become a good ICU nurse. So I did that, and I spent the next couple months while I was still on orientation becoming as proficient and as skilled a nurse as I could be. I finally was let off on my own, and now I had 2 patients, not very acute, but very tasky, and I'm sure you guys know what I'm talking about. And man, I continued to struggle. I don't think there was a single day I left on time. In fact, I don't think there was a day I even left within 30 minutes of being on time. I remember there was this room in the back of our unit where I would just be charting for like an hour after every single shift. And this was not fun. It really sucked. But that's the truth. And I struggled. So I eventually got better at that as I just put the work in and I continued to get practice in it. And I got certifications that allowed me to take care of like VADS and eventually CVVH. And I eventually got assigned ECMO patients. And then the acuity of my patients continued to increase and increase. And I eventually found myself in a role where I was always getting very sick patients on a ton of drips with all these really cool different technologies, different therapies. And I loved that so much. Throughout my whole time of starting as a nurse though, it was immediately clear to me that I loved the medical side of things. Now, yes, this is through the filter of really already making the commitment to myself that I would be a physician one day, but I was continually affirmed in my thoughts and my beliefs about myself as I felt that the medical side of things was what I was so interested in. I would dig into charts. I would look up medications. I would look at echoes and CTs. Not that I really knew about them, but I learned how to look at them just so I could understand more, so I could have a better grasp of what's actually happening with the patient. It's like treating myself to doing something that I can't really use right now, but it's like one day you'll be able to, and one day you'll be looking at this and you'll be making the decisions based upon it. And it was almost like a self-fulfilling prophecy for myself in a good way that I would get there one day. I was that annoying kid, that kid who would go to my coworkers and ask about their patients at 3 a.m. when they were just trying to relax. And I would stare at monitors for 15 minutes looking at the CVP waveform and then looking at the PA pressure and thinking about the blood moving through the heart, thinking about how all the drugs are interacting with one another. And I just couldn't turn it off. I couldn't stop. And I didn't really want to. Looking back, as I was reflecting and trying to think about what to say in this video, it actually brought me a lot of joy remembering how excited I was in those moments to learn. And not only did I feel a draw towards the medical side of things, but I also was affirmed in my belief that nursing was not for me because I did not love many of the nursing aspects. Obviously, it's all nursing aspects, but things that were more nursing specific, right? I felt like there would be days when I wouldn't sit down, where I was continually frustrated and just trying to catch up. Now, I understand that as a physician one day, I will have busy, frustrating, challenging days. There's no doubt. I'm not in any illusion that that won't be the case. But the role of physician and being busy with the tasks of the physician, I know is a lot more of my alley. I mean, it's what I want to be busy with. It's what I want to be frustrated with. But a lot of the nursing things were very challenging for me. You know, cleaning patients or giving baths in the morning, getting people up to chairs, just getting meds, having to call pharmacy to get one pill that wasn't in the Pyxis, or going through all these logistics of getting blood. And of course, these are imperative tasks to being not even like a fantastic nurse, just to being a nurse that gets the job done. But I couldn't deny the fact that these were things I didn't really enjoy. So again, I had a continued affirmation that medicine was the path for me and that nursing was not the path for me, but I was still a nurse. So what am I gonna do? Am I just gonna quit and work full time towards getting to med school? No, because nursing was incredible and I loved so many aspects of it. So I had to, in other videos, like I told you, I had to embrace where I was. I had to look at every single day as an opportunity to grow, right? What are you gonna do? Take 3 years and just like box those off and say that when you're 22 to 25, you didn't live a life, you were just working towards something that you'd accomplish a couple years down the road? No, you take each day for what it is and you grow from it, right? And you improve and you get better. So that's what I did. I embraced that journey. I embraced every single day. You can either get frustrated that you're not where you want to be, or you can take advantage of where you are as you're actively working towards where you want to be. And that's the decision that you get to make, and you get to decide how you're gonna approach each day. So I just wanna say, I don't hate nursing by any means. I'm a huge proponent of nursing. I mean, my family is a bunch of nurses. I loved so many aspects of my experience as a nurse. I don't hate nursing. Rather, I love medicine. And once that was clear to me, there was no other option. But I don't hate nursing. I truly do love medicine. And I have so much gratitude towards my time as a nurse. I haven't worked as a nurse in a year, and I will never work as a nurse again. However, I will continue to work with nurses on a daily basis. It has given me a perspective on the healthcare team. It's allowed me to work and practice in the healthcare setting at the most foundational level, which is patient care. From being 22 to 25 years old, I grew and matured more than any time period in my life. It's when I was an adult, I look back so fondly at that time. I made incredible lifelong friends. I've had incredible experiences, and I've made a difference in people's lives. I've picked up skills that I know will be so useful for me in my rotations, in my clinicals, as a resident, and so on. And I always take my experience as a nurse with me throughout my medical school education, throughout this journey that we're on together, through my time as a resident, and so on, as an attending. And I couldn't be more grateful and appreciative for my time that I spent as a nurse. And, I'll never forget that. So that's the video for today. If you guys feel some similarities in how I was feeling with how you're feeling, please share that below. Share with one another in the comments. And we're just going to continue to work towards our goals one at a time, but continue to embrace each day. All right. See you next video. Peace and love.